today. Okay, if I can have you verify your date of birth, name. Do you have any allergies? No? Okay, let me go ahead and... Okay, perfect. Thank you.
A trapeze bar will be used by the patient as an overhead assistive device to promote patient mobility in the bed. The nurse is seen checking for IV patency to ensure that the pain medication enters the patient properly. Here, we can see that the nurse is instructing the patient how to use the pump to allow for self-administration of the pain medication. We also need to remember that the pump limits how much drug can be safely given to the patient, and that the pump can be used over a few days or a few weeks. Before cleaning the skeletal traction, the nurse must assess the site and note any abnormalities. By assessing the site, the nurse can see if the pins are intact, if there is any drainage in the site, or any possible edema. The nurse will also use clean gloves to prevent contamination. The nurse will now prepare the materials needed for the pin site cleaning. The nurse will need cotton tip applicators, antiseptic solution, gauze pads, and a small basin to pour the solution in. Cleaning the site is an important part of keeping the skeletal traction intact and free of infection. First, the nurse will use cotton tipped applicators dipped in the antiseptic solution to clean around the pin sites. It is important to remember to use one cotton tipped applicator per pin to avoid cross-contamination and prevent infection. Next, the gauze will be dipped into the solution and used to further clean the pin sites. Again, remember to only use one gauze per pin site to avoid contamination and further complications. Afterwards, the nurse should document how the pin sites looked and any abnormality possibly found. As nurses, we need to ensure the patient understands how to use any equipment that is part of their teaching plan. Part of the teaching will include showing them different exercises they can do in bed, reminding them how to use a PCA pump, and enforcing the importance of not manipulating the weights and reporting pain, pressure, numbness, or tingling, and changing color in the extremity. Lastly, the nurse will answer any questions or concerns the patient might have. Also, don't forget to lower the bed and keep the call bell in reach.